Hi everybody. For my project I chose image number 16, and I actually chose this image because I also have a bifid uvula, and so when I saw it I recognized what the condition was immediately. And mine is not split as superiorly as this one is. Mine doesn't go all the way up into the soft palate like you see in this image, but I still thought it was interesting, and when I did look into it more I realize that it may also be a case of a submucosal palate as well. So what is a bifid uvula? It's also known as a cleft uvula, and this is a uvula that is split medially, and it appears that you have two uvulas. And so what the uvula does, it's part of the soft palate, and it helps us close the soft palate while eating and move the soft palate to the back of the throat so that words and sounds can be enunciated properly. And people who have this condition may have difficulty moving their soft palate posteriorly while eating, drinking, or speaking. And food also may not be digested properly, or speech can even be distorted in more severe cases. And then what is a submucosal palate? This happens when there is a lack of normal fusion of the muscles of the soft palate, and it happens when a baby's developing in utero. And 1 in 1,200 children have this, where I believe it's 2% of the population has a bifid uvula, and people with this condition may have a bifid uvula, so that's how these two conditions relate together. But they also may have translucent tissue along the middle of the soft palate or a notch in the posterior part of the hard palate. And so for the structures, I said the normal structures in the image were the symmetrical lips, and the tongue and lips were a normal color, the tongue was a normal shape, and the fauces looked normal. But then for the abnormal structures, I said the uvula is split in two, the soft palate is abnormal, there is teeth crowding and teeth rotting, and I said the hard palate may have a notch because it was hard to tell in this image, but it is a possibility. And I'm not sure if the teeth rotting were related to the bifid uvula directly, but it is a possibility. And the way this is related to SLPs in clinical practice is this is a condition that is normally diagnosed at birth, and it can sometimes be missed in infant examinations when they do an oral exam after a child is born, and if that's the case it may be diagnosed later on. In more severe cases it can cause phonation and swallowing issues. Personally, I have never had any issues that I noticed from having a bifid uvula, but as I mentioned previously, mine is not split very deeply like the one in the image, so it's more likely that I wouldn't have any issues. And SLPs may do examinations and listen for hypernasality with this, while some children need speech therapy and some even need surgery, while others need nothing. And the surgery would be out of our realm of practice, but speech pathologists could still work with children on speech therapy and how to overcome phonation issues when they have this. Thank you.